Extract 1. Questions 1 to 12.
Hello, doctor. Good morning.
Good morning. May I find out what the problem is?
I've been experiencing the symptoms of heart failure for the past year, doctor. Although it appears okay in general, I feel a lot of stress and fatigue. I've also noticed shortness of breath with exertion. I am getting attacks of severe shortness of breath and coughing that usually occurs while I'm sleeping. I have developed edema and had a mild leg swelling a while ago.
Do you have severe chest pain called angina, palpitations, or syncope?
No, doctor, but I feel some irregularity in my pulse. Over the past 10 months, these symptoms have been gradually worsening. Over the past year, I've gained about 20 kilograms in weight, doctor.
What's your age?
63, doctor.
Have you had any previous illnesses?
I had right inguinal hernia surgery 7 years ago. I had trauma to my right thumb.
Do you have diabetes, mellitus, or heart murmur?
No, doctor.
Do you smoke or drink?
I don't smoke, but I drink.
Tell me about your family history. Any illness?
My mother's alive at 92. My father died at 76 of a heart attack.
Are you taking any medications?
Yes, doctor. Aspirin, 81 milligrams daily, and chlordiazepoxide and clidinium combination pill at 5 milligrams or 2.5 milligrams, one tablet daily for stress.
Are you allergic to any medicines?
No, doctor.
Okay, well, according to my comprehensive cardiovascular examination, your blood pressure is 120/70 in each arm seated. Your pulse is 80 beats per minute and regular. Your breathing is 2 times per minute, and that is unlabored. Lungs are clear to auscultation and percussion. The first and second heart sounds are normal. You have a fourth heart sound and a soft systolic murmur. The precordial impulse is enlarged. Your electrocardiogram shows sinus rhythm with left ventricle hypertrophy. Your peak oxygen consumption was 19.7 milliliters per kilogram of body mass per minute, which is consistent with mild cardiopulmonary disease. Laboratory data shows your thyroid stimulating hormone 1.33. Your glucose is 97 and creatine 0.9. Potassium is 4.3. I reviewed your echocardiogram thoroughly. That shows a dilated cardiomyopathy with ejection fraction of 15%. Your post-stress ejection fraction is 33%, and left ventricular cavity appears enlarged. This appears to be a newly diagnosed dilated cardiomyopathy of uncertain etiology and dyslipidemia. I'm going to prescribe angiotensin converting enzyme inhibitor lisinopril 2.5 milligrams daily and a beta blocker carvedilol 3.125 milligrams twice daily. In addition, you could benefit from a loop diuretic, furosemide 20 milligram daily. I don't think you need a defibrillator right now, and after 3 months of medication, I want you to go on an echocardiogram. If your left ventricular function has not improved, then you would benefit from a prophylactic use of an implantable cardioverter defibrillator. So continue with these medications and meet me after a period of 3 months.
Thank you, doctor.
Extract 2. Questions 13 to 24.
Hello, good morning, doctor.
Good morning. Tell me, what's your problem?
Well, I have a history of first-degree atrioventricular block and had a pacemaker placement. I feel this problem of decreased eye vision. Last time the problem lasted for about 5 minutes. That occurred 4 weeks ago when I was driving the car.
Then how did you manage to drive?
Well, I was able to pull the car over to the side of the road without much trouble. During that time, I felt nauseated and lightheaded. When I approached the clinic at that time and received a CT scan, carotid Dopplers, echocardiogram, and neurological evaluation, all of which were unremarkable, I couldn't have an MRI due to the pacemaker placement.
Okay. Did that occur again?
No, doctor.
Any lesions or change in vision, headaches, change in gait, or other neurological issues?
No, doctor.
Do you have any back pain, bowel or bladder incontinence, or frank lower extremity weakness?
No, doctor.
What's your age?
57, doctor.
Do you drink or smoke?
I don't smoke, but I drink alcohol, only on some special occasions.
Any past illness or surgeries?
I had pacemaker placement for atrioventricular block, and I had bilateral knee replacement 3 years ago and have some pain in my knees.
What medications are you taking?
I have recently started on Plavix, suggested by primary care doctor. Other than that, baby aspirin 81 milligrams per day, Proscar 5 milligrams GD, and Synthroid 0.2 milligrams daily.
Are you allergic to any medication?
No, doctor.
Well, your physical examination shows your blood pressure at 134/80, your heart rate 60, respiratory rate 16, and weight is 244 pounds. Cranial nerves 2 through 12 are intact, and you have normal bulk and tone throughout. There's no cogwheeling. There is some minimal weakness at the R4 plus or 5, and possibly trace weakness at the quadriceps -5 or 5. You have decreased sensation to vibration and proprioception and vibration. There is no dysmetria or tremor noted. His Romberg is negative. You have developed transient ischemic attack. The character of his brief episode of visual loss is concerning for compromise of the posterior circulation. Differential diagnosis include hyperprofusion, stenosis, and dissection. You have lumbar stenosis. The symptoms are very mild and consist mainly of some mild proximal upper extremity weakness and very mild gait instability. You have to get a CT angiogram to evaluate the integrity of the cerebrovascular system.
This is the end of Part A.